All right, let's dive into one of the most critical calls you'll ever have to make in an emergency room, telling the difference between air and blood on a chest CT scan. Seriously, getting this right can save a life. So, let's make sure you get it right every single time.
Okay, picture this. A trauma patient just rolled in, they're unstable, and their scan finally pops up on your screen. The clock is absolutely ticking. You've got to make a call right now. Is that dark shadow in the chest air, a pneumothorax? Or is it blood, a hemothorax? Everything you do next hinges on that one decision.
So how in the world do you tell them apart? Well, the answer isn't some complex medical secret. It's actually just basic physics. It all boils down to one simple concept: density. The way different things in the body play with X-rays, that's what paints the picture you see on the scan, and it's the key to making the right call. And the technical term for this is radiodensity. Think of an X-ray beam like a super powerful flashlight. Dense stuff, like bone, completely blocks the light. On a CT scan, that blockage shows up as bright white. But air's like, well, empty space. The light just zips right through, and that leaves a dark, black area on the image. This lays it out perfectly. Look at the left. Air has super low density. The X-rays just sail right through, which is why it looks black. Now look at the right. Blood is much denser. It's a fluid, sure, but it's packed with cells and proteins that soak up some of those X-rays. And that absorption is what makes it show up as a grayish white. That, right there, is the fundamental difference you're looking for. Okay, so we've got the physics down. Now for the main event, the clinical showdown between air and blood. We're going to take that science and apply it directly to two huge, life-threatening conditions: pneumothorax and hemothorax. And let me be perfectly clear. This is not just some academic exercise for an exam. Knowing these two patterns and knowing them cold is a skill that literally saves people. Spotting the difference is the difference. So here's the cheat sheet. A pneumothorax, it's going to be jet black. It's just air, after all. The dead giveaway is the total absence of lung markings. Those little wispy lines of blood vessels you should see. And because air is light, it's going to rise to the top. A hemothorax, on the other hand, is gray or white because blood is denser. It's going to pool at the bottom, thanks to gravity, and you'll often see this really clear fluid level. It all comes right back to that simple idea of radiodensity.
Now I know, that's a lot to try and remember when you're in a high-pressure spot. So what you need is a mental shortcut, right? A simple mnemonic that just cuts right through the noise.
If you remember absolutely nothing else from this, please remember this. Black equals air, gray-white equals fluid. Say it with me. Black equals air, gray-white equals fluid. That's the phrase that's going to pop into your head and give you the right answer when you need it the most. All right, you've got the theory, you've got the mnemonic. Let's put it to the test. We're going to look at two classic clinical scans. Ready?
Okay, case number 1 is up. You're looking at the scan, and you see this dark black patch at the top of the lung. There are no lung markings inside it. What's your call?
That's a pneumothorax, 100%. It fits the pattern perfectly. And what's our rule? Black equals air. Simple as that.
Okay, case number 2. Now you see a grayish-white collection down at the base of the lung. It's even got a really sharp, clear fluid level. What are you thinking?
And that is a textbook hemothorax. Again, it follows our rule to the letter. Gray-white equals fluid. You see? Once you get this pattern in your head, you really can't unsee it.
So let's just wrap this all up and really focus on why this one distinction is so unbelievably critical in your actual day-to-day practice.
It really just comes down to this. These aren't subtle maybe findings. These are major life and death conditions that need immediate and very different interventions. Getting them mixed up is a huge deal. This isn't just about being good at reading a scan. It's about saving a patient's life.
So, you've made the call. Pneumothorax or hemothorax. You nailed it. Awesome. But your job isn't done. So here's a final question to chew on. Now that you've identified it, what is the next critical finding you'd immediately look for to figure out how bad it really is? Answering that? Well, that's your next step to becoming a master